Hi, my name is Julia Blanter. I'm one of the internal medicine residents at Mount Sinai. I just am presenting a poster presentation at ASCO this year, looking at distant metastases after diagnosis in racial disparities in breast cancer outcomes. Our project began as a follow up from a previous NIH funded cross sectional study from 2013 to 2020 designed to examine if insulin resistance mediated the association between race and breast cancer prognosis in self identified Black and white women. Our, our follow up research used this cohort of patients, but focused on racial disparities in breast cancer outcomes, namely in distant metastases after diagnosis. We chose to look at this after doing some background research. We learned that Black women diagnosed with breast cancer are more likely to have a poor prognosis, regardless of breast cancer subtype. And despite having a lower incidence rate of breast cancer when compared to white women, Black women have the highest breast cancer death rate of all racial and ethnic groups. This characteristic has often been attributed to late stage diagnosis. Our project was a retrospective study. We looked at 441 patients treated at the Mount Sinai Health System to assess metastases not present at initial diagnosis. We then performed univariate and multivariate analysis to find if Black women had higher rates of distant metastases after diagnosis, and if these still exist when accounting for factors such as stage at diagnosis and age. What we did find was that 7% of Black women had distant metastases after diagnosis, whereas only 1.2% of white women did. When performing the multivariate analysis adjusting for age and stage, Black women were still far more likely to have distant metastases after diagnosis. Therefore, we were able to conclude that the racial disparities still exist in the development of distant metastases, independent from a late stage diagnosis. After finding this, we sort of decided the study opened the door for a lot of future projects, namely finding the source of the continued existing disparity. In our study, we did note that Black women had a median follow-up time of about 2.5 years, whereas white women had a median follow-up time of 3.12 years. These differences were statistically significant. However, we were unable to account for those who may have transitioned to care outside of the Mount Sinai Health System and may be following at a different institution. I do think it would be beneficial to look at this more closely and see if there are true differences in follow-up time and if they are contributing to the poor outcomes. I think what we can take away from this so far is that there are several factors contributing to differences in outcomes between Black and white women with breast cancer. And although some of the disparity can be answered via pathophysiologic differences, some of it cannot be. And we should be looking at all of these causes of the existing disparities in breast cancer and how we can remedy them. Thank you.